Facial nerve palsy is a commonly encountered clinical case scenario. Let's learn how to differentiate between the two types of facial nerve palsy. So let's begin with LMN facial nerve palsy. So first thing, we have to ask the patient to raise the eyebrows and we should see the wrinkling on the forehead. So this is the normal side. We are able to see the wrinkles on the normal side. Whereas on the affected side, as you can see, there is no wrinkling over the forehead. That's the first point. Second is when we ask the patient to close the eye, on the normal side, the patient is able to close the eye completely. Whereas on the affected side, the patient will not be able to close the eye because of the involvement of the orbicularis oculi. The third point is, if you look at the nasolabial fold and compare it on the other side, on the normal side it is more prominent, whereas on the affected side the nasolabial fold is less prominent. The fourth point, when we ask the patient to clench the teeth, if you see, the angle of the mouth is deviated to the normal side. And also when we ask the patient to puff the cheeks, because of the weakness of the buccinator muscle, the air will leak on the affected side. So that was about LMN type of facial nerve palsy. Let's move on to UMN type of facial nerve palsy. The same examination again. When you ask the patient to lift the eyebrow, we will be able to see wrinkling on both the sides. That is the first difference between UMN facial nerve palsy and LMN facial nerve palsy. Second, when we ask the patient to close the eye, patient will be able to close the eye on both sides. So that is the second difference. Next, if you look at the nasolabial fold, this is normal. On the affected side, it is less prominent. And again, when you ask the patient to clench the mouth, the angle of the mouth gets deviated to the normal side. Buccinator muscle weakness also will be there on this side. Let's quickly summarize the difference between LMN facial nerve palsy and UMN facial nerve palsy. The most important point what you have to remember is, in UMN facial nerve palsy, the upper 1/3 of the face is preserved, whereas in case of LMN facial nerve palsy, the entire face is affected. Next is, the eyes are spared in case of UMN facial nerve palsy, whereas in LMN facial nerve palsy, the patient will not be able to close the eye. That is the second difference. The rest, all the findings below this level are exactly the same between UMN facial nerve palsy and LMN facial nerve palsy. That is, the nasolabial fold, if you look here, is less prominent. The angle of the mouth is deviated to the normal side. Here again it is deviated to the normal side. So those differences are common between LMN and UMN facial nerve palsy. So tell me, why do you think the upper 1/3 of the face is preserved in case of UMN facial nerve palsy?